Susan Monarez, a career government scientist with decades of public service behind her, is pushing back against efforts to remove her from her new role as director of the Centers for Disease Control and Prevention. Less than a month after she was officially sworn in, the Department of Health and Human Services announced that she would no longer lead the CDC. But Monarez is refusing to step aside, setting up a tense standoff inside the nation's top public health agency. The situation is unusual. Typically, when HHS makes a leadership change, the outgoing director quietly steps away to allow a smooth transition. This time, however, Monarez is signaling that she has no intention of walking away from the job she only recently began. Her allies describe her as deeply committed to CDC's mission and unwilling to abandon the agency during what she views as a critical moment for American public health. Monarez's appointment earlier this year was seen by many in the scientific community as a positive step. With a long background in government science, she brought experience and credibility to the position. She has worked across several agencies, developing expertise in emergency preparedness, biological threats, and global health security. Supporters argue that her skills are exactly what the CDC needs right now, as it continues to rebuild trust with the public following years of pandemic-related controversy. The Department of Health and Human Services has not provided a detailed explanation for why it moved so quickly to remove her. Officials only confirmed that her leadership at the CDC would not continue. That lack of clarity has fueled speculation in Washington about political pressures, policy disagreements, or internal clashes over management style. For now, Monarez is making it clear she does not view herself as out. Reports indicate that she continues showing up for work, engaging with staff, and asserting her role as director. The rare dispute is drawing national attention because of what it could mean for the stability of one of the most important health institutions in the country. The CDC headquartered in Atlanta has faced enormous challenges over the past few years, from managing pandemic response to battling outbreaks of new diseases. The agency has been under the microscope like never before. The questions about credibility, communication, and leadership have made its role even more sensitive. In that context, a public fight over its top position could add the sense of uncertainty. Monarez herself has not given a detailed public statement, but those close to her suggest she felt a duty to defend her role and protect the independence of CDC's science-based mission. They described her as determined, professional, and unwilling to let outside politics interfere with the work of protecting American health.